a treatment, medication-assisted treatment that should be provided to the patient on a based on a clinical diagnosis, whether someone is in prison, whether somebody is an outpatient, whether somebody's in therapy. We need to have protocols that are based upon best practices, and we need to incorporate the community so that we all know our parts. And we have wonderful hospitals. We have great hospitals. We have great treatment facilities. We have great detox facilities. We need to do this on a systematic, coherent, coordinated basis so families I work with aren't struggling against an ocean of ignorance to try to figure out systems. Systems need to be in place so that they work for the benefit of the client. And Gail, stop clapping, Ranieri. So Gail, and she's got all these fancy degrees, MD, MPH, but Gail Bernstein has done something tremendous in Erie, New York, in terms of coordinating those systems. Can you highlight that, Gail?
You talking about the task force?
And how you interrelate the medical with the detox with the treatment facilities.
Sure. So thank you.
Go ahead.
We have a task force, and as I mentioned, there are different work groups, and each work group, kind of chugs in their own discipline, and then through the task force, they're able to coordinate and consult with each other to make sure that we're all not working in silos. So we have a healthcare provider treatment group, we have an ED hospital group, we have a substance abuse treatment group, and those three we've been able to work together to number one, ensure that people who come in for substance abuse treatment get started either within 24 hours, usually that same day, depending on where they are in their detox. Because in New York State, traditionally, people have had to go through these evaluations that take 2 weeks, and they're either back on the streets and using or dead by the time that they're eligible to start medication-assisted treatment. So we're able to work with them to cut out all that process, and they're able to start within 24 hours. Also, we're working with all our emergency departments, and I think by July 1st, all the emergency departments, so that includes all the competing hospital systems, have put down their sabers and decided to work together on this one problem. So we have a large project where all the emergency department providers from all the different emergency departments, from all the different competing hospital systems, are getting trained to get certified to prescribe Suboxone, so that when an individual comes into an emergency department for an opioid-related problem, either an overdose or, say, a skin infection or whatever, it could be a lot of problems, they are offered the chance to start Suboxone so they can walk out of that emergency department with a script. I mean, after you get naloxone, you can't really start Suboxone right away. And then they can start their treatment. They're also given an appointment, depending if they're an urban area versus a rural area, to be seen within an average of 3 to 5 days by a substance abuse treatment provider. Sometimes it's the next day, but they get enough Suboxone to get them to that place. So, and they're also, the hospitals are making sure that the hospitalists don't stop anybody's methadone or Suboxone when they're admitted to the hospital for another problem, and make sure that they consult with pain management, some opioid alternatives for whatever care they're getting. We've also worked with our healthcare physicians prescribers to dial it down with the pain medication, and that includes the emergency department. And so with our EDs, in each of the EDs that we've looked at their data, over the past year, we've had sharp decreases in a number of opioid prescriptions of their patients. And then looking at our Erie County Medicaid data, forever hydrocodone has been the #1 prescribed drug, and in the past year and a half, it's plummeted to #5. And ibuprofen is now #1. So, again, we're all working together. We're doing a lot of community trainings of healthcare providers so they can prescribe Suboxone. And we're also training healthcare systems, especially our OBGYN offices, to implement SBIRT. So I don't know if you all know what SBIRT is. It's, it's medicine, it's an acronym, right? So it's screening, so S is screening, BI is brief intervention, RT is referral to treatment. So there are a lot of validated brief tools out there to screen for any type of substance abuse. If the person screens in, they get the BI, which is basically in a modified motivational interviewing, so they're provided with some type of counseling that helps them recognize that they have a problem and that they develop a plan, and then you have some follow-up. And for people who need a higher level of care, like with medication-assisted treatment, then they have these networks already, referral networks established, that they can provide their patients into care. And we have a grant from the Office of Women's Health to make sure that all our OBGYN offices are on board, because I'm sure as y'all are seeing in New Jersey, we're seeing a huge increase of neonatal abstinence syndrome, where women who are repeatedly exposing their fetuses to opioids during pregnancy deliver babies, and then the babies, at day 2 or 3 of life, develop withdrawal, which is terrible for an adult, it's terrible for a newborn, and the way to treat them is by providing them, an opioid. Now, I know in Buffalo we're giving methadone and slowly dialing down the dose to wean them off, and in addition to other kind of behavioral structural interventions. So we're working hard on that. Now our next challenge is getting our substance abuse treatment providers and our healthcare providers talking to each other better about hepatitis C. That is an emerging problem. I mean, it's huge in our area with, and the number one cause, especially, it's not the baby boomers. We're actually seeing more new hepatitis C cases among people in their 20s and 30s, and 90% of those are from injection drug use or the other, drug-related paraphernalia, because it's super contagious. And hepatitis C is a virus that infects the liver. It's the number one cause of liver cancer. It's the number one cause of cirrhosis and liver failure, and it's the number one infectious disease killer in the United States.
And Gail, I just wanted to just jump on you so that the Murphy administration just reduced from F2 to F0 to increase accessibility for hepatitis C medication, which is so incredibly important. And I want to thank the Commissioner of Human Services and the Governor's Office for that support, because that's life-saving support for those of our clients, many of whom have contracted hepatitis C.
Yes, exactly. So we're really trying hard to get our substance abuse providers to, to offer, to do the testing, and also kind of have more kind of wellness centers where they're able to offer hepatitis C treatment and other types of, primary care health. So we have a couple of our clinics are offering that already, but we're trying to get more on board, because again, the opioid addiction and medication assisted treatment will is a great start, but many times those individuals have other health problems that need to be addressed, and they'll end up dying of you can get them on recovery for their addiction, but then they'll end up dying of hepatitis C related problem.
Excellent, thank you. And just in deference to time, what I'd like to do is just briefly, in 30 seconds or so, if you could just reiterate what your most important insight or takeaway is. And Dr. Rosenberg, I'd love if you could just elaborate on some of the work St. Joseph's is doing around initiating MAT in the ED. So, Dr. Berman?
I think everyone who's dealing with anyone who has a substance use disorder, anyone who's dealing with anyone who has a substance use disorder needs to demand the same level of treatment for that individual that they would get for any other chronic illness, and that includes MAT, medication-assisted treatment.
All right, so from Dr. Berman, medication-assisted treatment from wherever you are in the healthcare delivery system. I'm going to translate into English.
All right. Well, I'll try my best at speaking in English. Talking, having people of different disciplines talking to each other, collaborating. If you work in silos, it is going to fail. You have to collaborate and develop unusual bedfellows and start working together.
And so that we need a coordinated system, integrated systems in terms of detox, in terms of treatment, the criminal justice system, and drug court. So thank you.
Right, and hopefully avoid detox altogether. You can just start
Amen.
medication-assisted treatment when you're in mild to moderate detox and not have to go through those terrible
Which
10
is
days.
preferred clinical.
Yep.
Dr. Ranieri?
One of the key aspects is to make MAT available, make it available in our opiate treatment programs. We at Seabrooks, our CEO was on the road to Damascus, and the scales fell off his eyes. It took me years of telling him about MAT and to offer it at our treatment facility. It occurred. Now we need that wave to go across the country and in other areas too. And also I'm concerned about authorizations like I spoke before, and telemedicine. Telemedicine can drive and get providers able to prescribe it in areas where it's not available. And even in our own state of New Jersey, there's areas where there's a really under ability for providers that are wavered. And one other thing, primary care medicine. Primary care medicine, we need to move in a direction where we're offering preventive care for addiction and then preventing relapses. So our primary care advanced practice nurses, our physician assistants, and our physicians need to be trained in addiction medicine and then offer preventive strategies, and people who are in recovery not to further, prescribe them medications that may cause a potential relapse.
Excellent. Thank you. Dr. Rosenberg?
I think we all talked about prevention and how important that is by not prescribing opioids when you can prescribe something else. We talked about treatment and the role of MAT, but we did not talk about harm reduction. There are people out there who choose to use, and it's very, very important that I stop seeing people who come in with endocarditis, which is an infection of the heart, where the bacteria from shooting inappropriately eats up the heart, or people who are paralyzed from a epidural abscess, an abscess in the spinal cord. There are ways to teach people to use drugs safely. Not that I want them to use drugs, but I want them, if they're going to choose to use, let's do it safely.
Thank you. Ms. Shea Kelly?
Thank you. Yeah, I couldn't have said that better myself. We're in the midst of an epidemic. Folks are already using, and they will continue to use, and that goes for all kinds of behaviors that some may consider vice-like. We need to address it and not have them developing abscesses, not transmitting so much disease, not sleeping in the streets, not being exposed to violence. We also need to ensure that I think everyone here believes healthcare is a human right, so it shouldn't look different if it comes to in a prison system versus in the community. It shouldn't look different if you're a Medicaid recipient, so that needs to be addressed on a systems level. But no, it's just an honor to sit here with all of you, especially the two gentlemen who came through the program and the journey themselves. It's great to see you gentlemen doing so well. Thank you.
I guess listening to everybody, obviously we have a problem here that's not going away anytime soon, and focusing on the treatment is probably the best way to attack it at this point. And I think we need to all just try and put our differences aside and work as a community, work together, and it's really saving one life at a time with this process, and I just want to thank Jim for having me out here today, and it's been quite an experience for me. And I want to thank everybody out there for coming, because this is, sometimes addiction gets nudged to the side, and it's a major problem. It doesn't matter what color you are, where you come from, how much money you have. It's at everyone's door in everyone's neighborhood, and someone was talking about before what Donald Trump said, execute, and that's not going to solve the problem. You're killing people that could get treatment, that could get help, because they have an issue too, That's basically it. Thank you for having me out here today.
Yep, Mr. Scott?
So I think the most important part of our program and what we're trying to do is using the recovery specialists to intervene, and then more importantly, act as navigators. People who end up in our emergency departments, who are in our hospitals, who have this problem, need someone to help navigate. And those recovery specialists who, as I said, have a minimum qualifications of being 4 years in recovery themselves, becomes the key to us making sure the patients get the navigation they need to be able to get treatment and to help them recover fully.
Yep. Excellent. Thank you. Dr. Kleinman?
So I've got a little bit of bad news and a little bit of good news. For actually good news, bad news, and good news. The good news is that on the national surveys, initiations and non-medical use of the opioids reached its peak in about 2001, plateaued for about 10 years, started declining about 2011, and is now more than 25% off its high. So if it were the case that this thing were driven entirely by foolish prescribing, we would be past the worst. So that's the good news. The bad news is that in New York City 5 years ago, 80% of the people who were Narcaned out of what otherwise would be a fatal overdose reported that they had started with prescription opioids. They had moved from prescription drugs to street drugs. Last year, that number was 50%. We are now getting substantial direct initiation to heroin and the fentanyls, which means that getting the doctors to behave better is not solving the entire problem that we have. And as somebody who's worked for 40 years around the problem of drug markets and drug law enforcement, stopping the fentanyl flow is going to be close to impossible. It's coming in by U.S. Postal Service because 3 grams of fentanyl is a lot. And we're not just getting parent fentanyl, we're getting all the fentanyl analogs, some of which are 1,000 times or 100 times as potent as fentanyl itself. Talking about stuff that's potent in the microgram range. I don't see a law enforcement way out of this. Now the good news. We've heard a lot about addiction as an incurable chronic relapsing brain disorder, something that people can be treated for but will have to deal with for their entire lives. That's true of some people. And people who do drug treatment, people who are in the criminal justice system, encounter primarily the opioid users who do have that chronic relapsing, quite possibly incurable form of the disease. That's not the only form it takes. Opioid dependency runs a spectrum of severity, and it runs a spectrum of chronicity. There are a lot of people who go through it briefly, come out the other end, don't have broken brains, don't have to be maintained for the rest of their lives. So let's not spread the word that everybody has a chronic condition you'll never get over, because it's not true, and there's no reason to give that message of despair. Yeah, let's hear that.
Hey, Doc, and Mark, I'm sorry, Patrick. Mark, can you just get 30 seconds to talk about our demonstration project we're doing with the New Jersey State Parole Board and the New Jersey Reentry Corporation? 30 seconds.
30 seconds. So
this is really good stuff. Go ahead.
So when people are on medically assisted treatment, that staves off withdrawal. That's good. In the case of Suboxone, it's also a blocker. It prevents people from using opioids and getting a charge out of them. Does not prevent them from using methamphetamine or cocaine or the benzos or alcohol or any of the other pharmacopoeia that we have out there. And in fact, about 50% of people on medically assisted opioid treatment are using illicit drugs. So there's a way to stop that if they're under criminal justice supervision. And that's use the same testing and sanctions regime you'd use if they weren't addicted. So we've got people on medically assisted treatment in lots of places in the country. We've got people on testing and sanctions regimes with certain fair regimes. Nobody's combined the two. So what we're going to try in New Jersey is to try a group of people and say, okay, here's your medically assisted treatment, and then here's the guarantee that you're not going to use anything else. We'll see if it works.
Thank you, Mark.
Yeah, excellent. And Patrick?
Jim, myself, I am done. I'm sick of it. It broke me. Rock bottom, emotionally, mentally, physically. Moving forward, reentry is the #1 best thing that ever happened to me in my life. But I love how this gentleman, scientist, said about fentanyl. That's what I take now. Not fentanyl, Suboxone. But it doesn't work. I need some form of assistant treatment, assistant living, where I could be helped, in life. The Suboxone, for some reason, I'm not a scientist, it doesn't work. But I would love to continue just on therapy, one-on-one therapy, and how you said, Miss Shay Callie, that sometimes psychotherapy is better than actually being on forms of medications, or you know what I'm trying to say? And I greatly appreciate that, Jim and Shay, and everyone that works for Reentry. And I'm not kissing your ass, Jim. I'm not kissing your ass.
I'll let you close.
Thank you. I'd like to thank Dr. Shah, but I just want to drive a couple of takeaways. One, I want to thank what Dr. Berman said. We have to be cognizant of medication-assisted treatment. We have to understand when it's appropriate and where it should be utilized. I think Dr. Bernstein, I think Gail drove to the fact that we have to cut across social service delivery and healthcare delivery systems, whether you're talking about the hospital, talking about the treatment facility, unfortunately detox, working across systems, but there should be a protocol that wherever you are, you have access to that protocol, which will result in the highest probability of recovery. And I think Dr. Ranieri, as Mark talked about particularly reducing the reliance of opioids, but Joseph talked about a protocol and understanding how that's to be utilized. And again, I want to thank Shay, who's a clinical director. I want to thank Rich. I want to thank Patrick. But I think what RWJ has done is great. We just need to have systems, to go to Gail's point, that cut across hospital lines so that we have practical systems with high accountability, with measurable results, so that Patrick and Rich isn't bad for a white guy from Ocean County, that they have access to that level of health care. And lastly, I want to thank our medical director, Akash Shah. Obviously, I'm not easy to put up with, but I want to thank him for his great patience. Thank you, Shah. Thank you, doctor. All right, you guys are off. Next panel is coming up. Where are our chairs? And while they're coming up, and I'm honored to have the Attorney General and the First Lady and Haywood Gandy and Judge Orleo, I want Candido, come on up here. And I'd ask Candido, who's going to share a little bit of his story. All right, can we move the tables quickly, Anna? You can leave those. Okay, don't worry about them. Don't worry about them. Tables and chairs, guys. Come on, Kikowski. Good. Candido, share your story.
Okay, good evening, ladies and gentlemen. My name is Candido Ortiz, and I was released in 2016 by the President Barack Obama.
Right up here, right up here.
After I did 27 years in a federal prison, and in 2016, I was released and with 5 years of federal probation.
Closer.
As soon as my release, I went to my PO, and she recommended me to come to the New Jersey Reentry Corporation. When I went over there, those people treat me the way they're supposed to be when you come from a place that you don't be in the street for the last 27 years of your life. And you don't know how the society is going. You don't know nothing, because over there, the only thing that you concentrate is do your time, try to do it better, or try to do it worse. It's two ways to do. Or you do it the right way, or you do it the wrong way. But I try to pick all the time the right way. And there was a reason that the President of the United States checked my case. And after I did 27 years, he released me. My total sentence was 50-year sentence. But he released me when I was only 27 inside. After he released me, that I come to the New Jersey Reentry Corporation, my life started change, because I started learning how the street goes. They teach me the right way to do. They find me a job. I'm a chef. And in 5 days that I was with them, they find a job for me in a local restaurant. And I spent 11 months working, and today I got my own restaurant.
All right. And where's the restaurant at?
My restaurant is in the 31st Martin Luther King. And I decided to go over there because in the past I did wrong to the society. And now I try to change my life, and I try to do it the right way. So I'm over there helping the people that need help from me. And when they need some help, I send it to New Jersey Reentry Corporation, to the governor, Jim McGreevey, that he can take care of them. I can do it the best I can, but I don't do it much. But I try to do the best I can.
And I just want to say thank you to Candido. Candido was sentenced to 49 years in prison. Thankfully to President Obama, it was commuted. Thanks to, I want to thank John Kufos, I want to thank Shay, I want to thank particularly Bolivar for Latino outreach. He has his own restaurant, he's been unified with his family, and he has the best chicken, beans, and rice of anyone in Hudson County. So thank you very much.
All right.
Thanks, Candido. And I just, there's a couple of prosecutors here. I just wanted, this is like the VIP, but you know, our clients to me are our VIPs, but I also just want to recognize, I see our Ocean County prosecutor, great Joe Coronado there. Joe, could you stand up? My dear friend, former chairman of the State Parole Board, and a great guy, Jim Pelosis. Yep, Jimmy, stand up. Sam Plummerai is chairman of the State Parole Board. And Esther, where's Esther? Esther, stand up, our Hudson County prosecutor. And also we have Ruthie Byrne, who's a dear friend. And so we're going to just, oh, and we have our new MVC commissioner. Thank you very much, and a really important partner in terms of licenses.
Prosecutor Koch.
What?
Koch from Sussex.
Koch. Oh, yeah. Oh, and Fred is also from Morris. He's a prosecutor from Morris County. Here, Fred, the Ganselmacher. Thank you. And prosecutor from Sussex. Thank you very much, prosecutor. Thank you very much. Are there any other prosecutors here? Oh, thank you. Newly appointed prosecutor. Thank you very much. Prosecutor, can you, where are you from? Gloucester County. Thank you very much. Really.
Dennis Calla.
What?
Dennis Calla.
Oh, and Dennis from Bergen County. Thank you very much, first assistant. Hey, now that we know who to avoid.
Colonel of the State Police.
Right, yes, right exactly. Look at. And my dear friend, the Attorney General, is telling me the Colonel of the State Police is here. Colonel, could you please stand up? It's about the only thing the Irish have left in the pension system. Thank you very much, Colonel. So this is a really great panel, and this is a great conversation. And I'm just going to like throw out questions, and then we're going to break for lunch, and then we're going to blessed to have one of my favorite human beings, Cardinal Tobin, and then a dear beloved friend, Senator Bob Menendez, and two great panels afterwards with my dear friend Joe Hayden, and subsequently. So the first is Judge Arleo, Madeline Cox Arleo, happens to be from St. Paul's in Greenville. Can somebody please clap for Greenville? Madeline was started out as a magistrate, reentry court, and now is a federal district court. Judge, could you tell us a little bit about why reentry is so important?
So I want to begin just by thanking the governor, Governor McGreevey, for his programs, because we wouldn't have a model to do what we do on the federal level without the help and the guidance from the best practices anywhere, which is the New Jersey Reentry Corporation. So thank you. So we started a federal, under President Obama and Eric Holder, we started reentry courts on the federal level, really with very little funding, but with commitment from a team of U.S. attorneys, probation officers, public defenders, and we take a very individualized approach. We look at every single person as a person that has needs, and we try to help the whole person. We do it without any extra funding other than what we have through probation, but there are some common themes, which I think is something I'd like to talk about in terms of alternatives. In the federal system, many of our participants spend 5, 10, 20 years incarcerated. And the transition back to home is usually a brief stay in a halfway house where they really aren't given any kind of services other than the order to go get a job. And then they're told, we're going to take 25% of your net pay. And so they come to us, and what we ask them is, come every 2 weeks. We'll give you a year off probation at the end, and we'll help you in every way we can. So what we try to do is untangle the mess that they're left with from, number one, driver's licenses. I can't tell you how many lawyers we have. We have a great pro bono system of lawyers. How many lawyers it takes to unravel not only just getting their license reinstated, but someone used their license and someone got tickets and there's fines and they have no money and they're living on their aunt's house on a couch and they have $4,000 worth of fines. And it's through John Kufos and Governor McGreevey that have really helped us train our lawyers to try to unravel driver's licenses. People have had no ID some their whole life. Have driven, but the joke is, well, I know you know how to drive, sure, but I've never had a license. So unraveling that. No GEDs, or if they did, the first time they had a GED was when they were incarcerated, had exposure to that. No training, like zero training. And we've learned, and I should know Caroline Selesky's from the U.S. Attorney's Office is our partner on the U.S. Attorney end, that you know, without jobs and without real paying jobs, there is no hope. But here's the good things. A couple things I want to share with you. One is that our participants are hardworking and polite and smart and good. And they really need people in the community to step up and help them with jobs. And we've seen it. We've seen people in our community, in Essex County, Hudson County, give jobs that are not just minimum wage jobs, but jobs that have a future. And that is what gives everybody hope. And we have to really prepare, whether, you know, I read an article just this week that there are 16,000 federal inmates who are waiting to get training to get their GED. That shouldn't be. And if folks are going to have long prison terms, we have to do something better to train them when they're incarcerated, so when they get out, they're not starting from 10 feet below. Because I can't tell you how many of our participants have said, without you, without Lauren unraveling mental health issues, and I've even touched on addiction, but mental health issues and PTSD issues and no skills, no education, no jobs, no family structure, no one to live with. I've had guys in homeless shelters, we've had guys all over the place. But we need a system that helps rebuild lives, and we don't have one now. And that's my hope for the future.
Thanks, Matt. I'm just going to jump in. Haywood, can you talk about where you're from and what your experience has been? Into the mic.
Good morning, everybody. My name is Haywood Gandy. I've just come
Into
home.
the mic.
I just come home from doing 20 years. And in the process, I'm in the...
Wait, are we clapping for the 20 years or that he's home? Okay. I just couldn't figure out.
In this process, I'm in the halfway house part of it. And I feel blessed and lucky to be in the state of New Jersey. And I say that because I'm a full-time student at Rutgers University.
Hey, quick. Come on.
But when I first came home, I got to go to the New Jersey Reentry Corporation. I didn't know anything about a computer. I didn't know how to fill out an application online. I didn't know how to navigate the internet, which was barely an idea when I went into prison. And I got to go to a place where I was treated with respect. They understood the issues and challenges that I was having. I wasn't embarrassed to say, I don't know how to do this. When they said, well, just go turn the computer on, I'll be there in a minute. And I'm standing there looking at it. It wasn't funny to me at the time. But, and someone walked me through this entire process. I had 29 tickets when I came out. I could not leave the halfway house because you can't leave a halfway house when you have warrants for your arrest. New Jersey Reentry Corporation has a team of attorneys. Kim, who's here somewhere, got all the tickets expunged, allowed me to leave the halfway house to go to the center to get the job training, to get a job. I work for Jersey City Employment and Training right now. But this process, where men and women, we're individuals who are coming home who, if you give us a chance, most of us, and there will always be people who reoffend and who are going to be a danger, but most of us, if you give us a chance, if you remove just some of the barriers, we'll make it. If you just remove some of the barriers, I'll be on an academic scholarship at Rutgers.
All right, I gotta just jump in. All right, so Judge Orleo talked about barriers, institutional barriers. Hay talked about the need to provide for those entry-level services, which I think we do. But there's also a challenge of addiction. And I think what we need to understand is when we heard Dr. Kolodny and the doctors and the last panels, is to understand, particularly with the advent of the fentanyl crisis, it's very difficult to get addiction treatment in prison. And I want to, like, I am the greatest, I don't know if this helps him or hurts him, but I am the greatest Gary Lanigan fan in the world. But I'll come out against you if you want me to, Commissioner. But because what he's done in Mid-State is certainly nothing less than a miracle in terms of providing addiction treatment. But I think what we need to understand is that unless we get people enrolled in Medicaid, connected to IOP, which we do in terms of the New Jersey reentry, but when we have 4,000 clients and there are 48,000 people, as my dear friend John Brogan knows, that are coming home every year, we need to connect people to healthcare treatment. And for many of our clients, they're ineligible for drug court. I mean, there's a whole question of whether or not drug court, frankly, is providing for medication-assisted treatment based on best practices. And that's something we have to grapple with, and they've made great changes. But I also want to sort of, when the reality is, if you don't qualify for drug court and you go to a criminal court, the reality is you don't get sentenced to treatment. You get sentenced to prison. And one of the real challenges in my life is that when I see many of our clients that coursing through the system, they're ineligible for drug court because of their past criminal history. They can't get expungements because New Jersey has these antiquated expungement laws. You know, when Mike Pence's Indiana has a more progressive expungement law than New Jersey, you know we're in trouble. So one of the things that, and I'm really blessed to have an attorney general who believes in treatment, and my dear friend Larry Lussberg is going to be up here talking about legislative changes. But I just ask the general, who believes in us 100%, there's nobody as a better advocate. Can we have a round of applause for our attorney general? By the way, you talk about marrying up. This guy, never mind. Way up. But I just wanted the general to talk a little bit about the idea of working with the county prosecutors and grappling with the whole question of sentencing and the whole question of how we look at addiction. If addiction is the systemic cause of crime and you coursing through the prison system, and even if Commissioner Lanigan does everything right, not everyone is going to have access to treatment, and you're just going to spend time, as Rich said and as Patrick said, getting worse. What can we do to change that in sentencing guidelines?
So I want to.
I'm glad you're here to get the easy question.
Yeah, no, I want to thank you for that introduction. I think, but I'll let my wife know that you said that. It's really an honor and a privilege for me to be here, and I'll get to the sentencing point in a minute. But what I want to say is that, as Dr. Kolodny so clearly stated this morning, we're in the midst of an unprecedented crisis, and it requires an unprecedented response. It requires a response that brings together all of us in this room. So if I look at doctors, I look at lawyers, I look at government officials, the colonel of the state police, county prosecutors, treatment professionals, all of us need to get together to respond to this crisis, because the numbers we talked about earlier this morning, the 60,000+ deaths in 2016, the 2,000+ deaths in New Jersey, the 10,000 Narcan administrations in 2016, 700 deaths already this year, over 2,000 Narcan administrations already this year, and that doesn't even include the ER. So clearly the fear of death is not preventing people from using. It's not preventing people from committing crimes. What we need to do is intervene early. So before we even get to sentencing, Governor, what we've tried to do, we did it in Bergen County, was Operation Helping Hand. Instead of naming and shaming people by arresting drug users and putting their pictures in the paper and embarrassing them and adding to the stigma of addiction. What we wanted to do was have a program where we had treatment options lined up for them. So if we were going to do a narcotics sweep of low-level offenders, we wanted to marry them up for treatment, that warm handoff that was talked about, but a warm handoff in the prosecutor's office. When people are being processed, to have that recovery specialist there, to have that clinician there, to have the detox beds, if they need detox, available to them, if they need outpatient, inpatient, to have all of that lined up. So it's that type of coordination that's required.
So is all 21 county prosecutors going to be doing this?
Soon. Soon. So
well, when's the deadline?
Well, in June, we're going to roll it out with 6 counties, but let me just share the numbers. In April, the last initiative we did in Bergen County, April, 43 people arrested, last April. 43 people arrested, 27 went into treatment because of our recovery specialists who were persistent and kept on them. Out of those 27, 13 were in some form of treatment 6 months later. One of those who was in treatment is now helping us in the most recent initiative we just had 2 weeks ago. One of the women we helped was a mother with 2 master's degrees who was a teacher who we arrested while she was on her way to purchase and cop heroin in Patterson and using on the way back with her 4-year-old in his pajamas sitting in the back. She's clean today. So that's proof of concept. That means that these forced interventions in the jailhouse are working. And so we did it in Bergen successfully. We're going to roll it out to 6 of our county prosecutors. And I think with these types of innovative programs where we're all getting together, all of us in this room, and addressing the issue together, we're going to not even get to sentencing. We're going to capture people earlier. For sentencing, of course, we need options. We need treatment options. We need to have MAT to be a part of the drug court. And I'm looking forward to the best practices when they come out shortly. And I hope it includes that. I hope it includes Suboxone. And I hope that we have legislative barriers removed to the ability for doctors to prescribe Suboxone. But my goal is to capture and help people earlier and to get them into treatment earlier through those types of forced interventions.
Sure. And I want to thank, and we can talk about Ocean County and some of the great reductions in mortalities, but I also believe that we need to drive treatment as a sentencing option. And just candidly, my frustration when I see we have 4,000 clients, 70% of whom have an acute addiction crisis or familiarity, that they need to have treatment. And for so many of them, their criminal activity has been a result of their addiction. And I just think if somebody's not in drug court, they're almost, unless they have it through the commissioner, through DOC, they're almost precluded from treatment. And I know that's a hard thing to get around, but I think we really have to push the criminal justice system to understand at the end of the day, these are addicts who need treatment, not just merely criminals who need incarceration. And we have to, that's a hard thing to grapple with, but I'm going to get it from Lenny Ward later in the parole board. So I just want to, Caroline, in terms of the federal system and what you do, how do you determine who's, how do you determine who's eligible for reentry?
If someone is coming out on supervised release and probation determines that they're at a very high risk of reoffending, then those are the people we'd like to come into our court. But it is a voluntary program. So we have to persuade them that we're going to be good for them and that they want to return from a very institutionalized setting and then have a close contact with the court, which is a real challenge.
So it's changing the understanding of the court. And I was there with Judge Arleo, and I was there. It was incredible that you had guys who used to avoid court now walking into court because they understand that the court's providing opportunities and services for them to move forward.
Right. We have to persuade them. We don't just see them anymore in one small part of their lives, that we see the whole person. And so that's the renewal of our relationship with them and their relationship with the criminal justice system and with the entire set of services and options, seeing them now as a whole person, that we will see them and respect them. And that's what Judge Arleo is so brilliant at doing. She sees the humanity in people, and they respond to that right away.
Let's jump in. And for a lot of these guys...
Could you pick up the mic?
A lot of these...
It's on, Judge.
a lot of these guys have very negative experiences with the criminal justice system. And one thing that, well, I married two of them, not to each other, but to their girlfriends, because I'm all for marriage. So two of them have been married in my courtroom with their families and with the entire team there. And the most, Caroline doesn't, take enough credit, but, a prosecutor is there to put you in jail. And to have prosecutors become their friends and to be the ones helping them and helping their kids and doing all the good things that friends do for each other is really uplifting. And to have them bring their families to court just to watch, having their kids come to court to meet us, it really is, it's a whole different view of criminal justice, not just to take people away from their families, but to help them unite their families. And I think that's one of the things that is so great about having our U.S. attorney so involved in it.
And I will say, one of the participants said that he knew that his life had changed when he was leaving court one day and he had to bring home some food that people had brought him at court, and the public defender who works with us offered him a ride in her car, and he said, that would never have happened before. No one who looks like that in that role would ever have trusted me to get in her car and drive her home to my house, and he knew everything had changed for him.
Thank you. So Reverend Bartley, Rev is with the National Action Network. He not only sort of buys bad hats, but he helps us to lead the National Action Network and is a dear friend and a great partner with Reentry. And he's a leader in the faith-based community, and he works closely with Reverend Al. And I just want to ask him for his sense of where Reentry is, not only in healing the persons that are coming out, but in healing the community. What does Reentry mean?
Reentry means so much to me because you all are sitting here right now listening to me, and I was a part of the system.
Amen.
The system that I think that we're missing, and that is, even though you might think of a person with an addiction, it's not always a drug addiction. I was a drug dealer. I sold drugs, and I had an addiction with selling drugs. I thought that was the way to go. And what many of us are not doing is trying to reach out to those who are in the system that are coming out that have not the resources that the Reentry program is trying to provide. And if we don't have a continuous effort in that, we're going to lose a whole group of individuals who are many of our sons, our grandsons, our daughters, that are coming out of the system and can't find a job because they don't have a GED. They don't have a driver's license. They don't even have a Social Security card or a birth certificate. And so how do they come out after spending years? I spent 3 years in prison. I spent 1985 to 1986. A lot of people forget that about Reverend Bartley. I was in Bordentown when they named it Gladiator School. But I came home and got connected to the right people that saw something in me. As my young brother mentioned, he's like my colleague. I've been to college, I have a doctor's degree, but this is my real colleague right here because he's been in the system and he knows what it's really like. And to be able to come home and have the programs that the Reentry program under the leadership of former Governor Jim McGreevey is trying to provide, that is so vitally important. Now I'm able to say the same people that used to lock me up, they call me and ask me for advice, how to get things done. The colonel, the attorney generals, all of them are saying, we need Reverend Bartley. When drug court first started in Union County under the leadership of Judge Catherine Dupree, I was the first keynote speaker. Carol Vendetto, prosecutor, she was there. And they reached out and said, we need someone that's been in the system. And it is those that are working with Governor McGreevey that knows what it's like. You have to have been there to know what it's like. I know the Attorney General mentioned that he made sure that all of his prosecutors spent a day in jails, saw what that was like. Oh, one day, that's it? Think about 20 years. Think about
Amen.
I wish I could have said some longer.
And so, Governor, I think that what you're doing and what we're offering, and I'm so happy to see our First Lady here.
Amen.
First Lady Tammy Murphy here, who has that same passion. And it's going to be up to us to make a difference. So many people are looking at individuals, and they're looking at them from a different perspective. And Reverend Sharpton says it this way: there are those who are looking at people with clean hands but dirty hearts. And then there are those who are looking at ex-offenders who are really potential individuals that has dirty hands but clean hearts. And all they're looking for is an opportunity. And so I urge this state, I urge our administration, I urge legislation to please, let's continue to fund prison reentry so that these individuals can get the help that they needed. Thank you.
Amen. So, and by the way, if anybody's interested in golf lessons, Reverend Bartley has the best handicap up here. But I just wanted to pick up, when you heard from Reverend Bartley, you heard from Judge Arleo and the prosecutor, it's also about understanding that we have to work together. And we heard this time and time again, understanding that addiction not only has a criminal consequence, but if we're going to restore people, they need to have treatment. And Caroline said it, and Judge Arleo, my dear friend, talked about treatment and these other services. And we're really blessed to have the First Lady. And I want everyone to know that Tammy Murphy isn't here. This isn't her first reentry conference. She was here last year also, when she didn't have to be here. And she's been passionate, and she's been an advocate for reentry. And Tammy, I just wanted to ask you your sense of, as a mother of 4 children, God bless you, what is it, how do you see reentry, and as a mother, how do you see the addiction crisis? And just listening to the doctors, do you have a sense of how do you think we could do this better?
First of all, if I knew how to do this better, none of us would be in this room right now. So I'd like to preface everything by saying that. Thank you for having me. It's a real honor for me to be here, and I bow down to you and everyone in this room for taking the care and the time to be here today. Clearly, as a mother of 4 children, I am alarmed by the increased usage of opioids and the deaths and the addicts, and it's not just across the United States, it's here in New Jersey. Also, as a mother, I harping back to Dr. Burstein in the last panel, she talked about the incidence of neonatal abstinence syndrome. 500 babies in the state of New Jersey have been born with that since 2011, which is really horrible. I mean, that's just a fact that we have to understand, why is that? I would propose that the mothers of those children probably come from low-income families, probably did not have access to prenatal care, probably suffer from HIV infections, from hypertension, from all sorts of diseases, and they are not being treated properly. I probably shouldn't say this, but I will say I look at our president, who last year declared that the opioid crisis was a state of emergency, and yet the response has been draconian. It's been, let's have further law enforcement, let's have bigger penalties, and it hasn't been, let's look at integrated care. And I think here in New Jersey, I'm listening to everyone, I think we all understand that this is not necessarily these are not people who necessarily they don't want to go to jail, they want to get help. And so we have to come together as a state and as a people and as individuals collectively to try and help everyone with this treatment. And that's going to be both while people are incarcerated, which I think is very important, and also once they are back in our communities.
Thank you. That's wonderful. Thank you for that statement. Hey, could you talk to a little bit about what was singularly the most impactful thing for you to maintain sobriety and healthy living?
I think,
and speak closely into the microphone.
Okay. For me, I owe a great deal to the Commissioner of the Department of Corrections, not just because I'm still technically incarcerated, but I spent the last 3 years of my
Yeah,
prison.
that was very good. Very good.
Yeah. No.
Shouting out to the Commissioner of Corrections.
No, but in
been hanging
all
around with Randy
reality,
too
the
long.
last 3 years of my prison bid, while I was behind the wall, I spent in Northern State Prison in a TC program. And at the same time, I was a student at Mercer County Community College behind the wall through New Jersey STEP. So when I was getting ready to leave prison, I was getting treatment 24 hours a day, 7 days a week, where I lived behind the wall. I was getting an academic education that allowed me to graduate with a 3.9 GPA, and that's and then when I left, when I got out and got into the halfway house, and I was able to go to New Jersey Reentry Corporation, but it's no one thing. When I said I'm proud to be in the state, we've got everything that we need. Everyone in this room. We've got the Department of Corrections. We got the State University. We have New Jersey Reentry Corporation. We've got all the pieces, but what has to happen, and I'm saying this to all of you, and I know there's a bunch of prosecutors and the state police here, but what has to happen is everyone's got to get out of their individual sandbox and realize we're all in the same sandbox. Stop trying to hold all your toys. And there are other people that provide services better than what you do in one area, and you specialize in what you do, and then pass them off. Let that transition be smooth. Let that transition be so if someone needs treatment in this area and you provide housing, you do the housing and then send them there for the treatment. We got everything we need right here. We got a commissioner that's helping on the inside. We've got New Jersey Reentry Corporation that's helping when they get out. We've got the State University that is allowing someone like me that spent the last 20 years in prison to be on an academic scholarship, to earn a degree so that I can be the productive member of society that my mother has been praying for the last 20 years of my life. But it's up to you. It's up to all of you to listen to the men and women that are going through the system, because some of the stuff you're doing isn't working. But if you don't listen to us, if you don't hear what's really going on, if you stay in your closed rooms, you're never going to get the truth. Talk to the people who are receiving the services. But more importantly, work together.
And Governor,
all right.
And Governor, that is key. That is key. That is collaboration. Know your niche. Know what works for you. And then allow the other individual to work his and bring it all together.
Well, but just you know, and Tammy's here, but I've wanted a reentry task force. I'm going to step out, but we really need to integrate systems. And that's what I think we can do with corrections, with parole, with healthcare delivery. Selfishly, I've got like 20 years left of sentient life here. So I you know, and I see a Haywood, and I see a Bolivar, and I see this beautiful young woman right here. We've got to leave. This is the future. This is the future of reentry, and we've got to leave them a system that's integrated, consistent, constant, measurable systems. And Jen, just say a little bit about your treatment and your experience with reentry, and give it up for praise.
Good afternoon. I'm sorry. Hi, everybody. I'm going to make this real quick and simple. I'm a little nervous. My name is Jennifer Naylor. I'm 32 years old. I've been a resident of Essex County all my life. I went to Bennett College, the first black college for female women out in Greensboro, North Carolina. I went on a scholarship. I was valedictorian of my high school, Newark Vocational High School. I was in a drama club. I did everything. I did a lot of activities. I'm not your usual story. Usually you get juveniles in and out of jail. In my situation, it was a little different. I went to school, and due to coming back home on vacation, sometimes we love our friends, but sometimes we got to pick people, places, and things, especially when God is blessing your life. I think I took a lot of things for granted. I kept hanging in certain areas, even allowed me to get involved in certain things, and I was arrested. They had did I forgot what it's called when they come, a raid. They did a raid. See, I don't really know anything about that. They did a raid, and not knowing that, being that if I'm there, it looks like I'm doing something. So I believe that that's when everything changed in my life. 2009 was so hard for me. I was incarcerated, so imagine your freedom, everything getting taken away from you, and you don't got no idea. You don't got nobody to talk to. I studied law in school. That's what I took up. I was a political science major. Politics was always my passion. So imagine everything you ever worked for, it just get taken away from you, and they don't ask you nothing. They don't ask you, was you there? They don't look at cameras. So I'm going through all these changes.
You were wrong to be there.
And I was wrong to be there. So
let's keep it.
So to be honest, I've learned that that moment in my life, being that it was a big change, it showed me that if you do the crime, you will do the time. But I came home, and I was blessed with a good job in accounting with the Giblin Association out there in Carwell, New Jersey. Tom Giblin, he's a great man. I'm a two-time felon. And Mr. Giblin gave me a second chance, not knowing when I was released I needed help. And I'm going to make this quick. Reentry program, I acknowledged that I had not a mental problem because I'm not crazy, but I had a mental problem. I was making $85,000 a year, but I didn't know how to take it in. I ran the whole dues department in Carwell, and I believe that this moment in my life, I understand why everything happened the way it happened. I was being slick. I thought that being that I was in school and doing the right thing, that no one would never find out what I was doing behind closed doors, and that was selling my little marijuana. So when I got caught up and I acknowledged that I'm here for a reason, being in jail, I didn't take advantage, because some people say when you come home, you go back and you go back. No, I'm not going to become a statistic. I don't care if I was locked up for a year or 2 years or 30 years. I'm not going to be a statistic. So I promised myself this time around in my life that if God, you release me, I promise I don't care how much money I don't have. I don't care if I go broke. I'm not going to go and sell no marijuana ever again. And I was using more than I was selling. But, however, when I came home, I realized that everything was dropping in my life. Like, I lost my apartment in Carwell. A lot of things was going wrong for me. And my little sister here, and I brought her here today because she was the reason why I went to college. Like, she was the reason why I've changed my life, even being in the streets, is because I wanted to be an example for her. And I believe that everything happened in my life and everything that I accomplished, even the bad, it showed me and lead me to McGreevy. Because this guy, he's amazing. And if you guys wouldn't believe the story, it was back in 2009. I brought that paper there with me for the Democrat Party just to remind me of who I used to be, because I remember about to have a breakfast meeting with this guy, and I was late and I couldn't make it. And I remember saying to myself, like, I know that I'm going through what I'm going through for a reason. Now, the story for the reentry program, I happened to walking down the street. I was hungry, going home, and I looked across the street and I said, this place been there for a while. I never, and this to tell everybody, no courts, the judge, the cops never forced me to come here. I walked in on my own will. This is the first thing that I ever did without the courts telling me to do. So this time in my life, I feel as though I am now being my age. I believe I took things for granted. At a young age, 25 years old, making $85,000 a year, and I'm just coming home from a charge. I didn't think it could get any worse. I thought I was living in heaven. I thought everything was good until it hit home where I don't have nothing. I'm so used to giving people on the street, homeless people, $20, $10, and I found myself in a situation where I was homeless. And it's because of my pride. I didn't want my family seeing everything that I've been through, and like just to see me now in the streets, you know. So I made a change in my life. I said, this point forward, it ain't about being sneaky. It's about me being honest with myself. And due to being in the streets, I turned to Percocets. And I was just only doing Percocets because my stomach, I get bad cramps of whatever since I was 14, 15. And no, I don't have any kids. So I guess they say when you don't have kids, you get them worse as a woman. So I get some worse. I can't go to work. I can't go to school. So due to that, no one ever heard this story, even my sister. So this is her first time. I started getting addicted to Percocets. And that moment in my life, I knew that this is not me. So being here after these 5 years, I've been going through changes, just trying to get right. Just imagine having a lot and then you don't have nothing. So mentally it was bothering me because I'm not used to settling for less. Should I say settling for less? So being here in the reentry program, they made me find myself like, I got control of my life. I know what I want and I know what I'm not going to do. Certain areas in Newark, and to this day, I don't go around at all because at the end of the day, I forgot who I was to love myself. And I was really like killing everything about everything. I wasn't even talking to my family anymore. So being in this program made me find myself. I love myself too much to be a statistic to anyone's situation. So this opium thing, if I have to fight for my community, because I don't know if you guys understand what these people saying up here. I'm in the community 24/7. I see the kids that's getting high, that's under 18 years old, and it doesn't matter if you're from the ghetto, because guess what? My mom and them had it. We never had to want for nothing, and I was affected by this. So we need to prepare the kids that's not even in the ghetto neither, the suburbs, because we don't have no acknowledge of anything. I'm 32, but I'm just getting off the porch. Now imagine the kids that's in the suburbs that's just getting off the porch, that don't have acknowledge of these type of drugs, and I'm only taking the drug of pain and not knowing that it was mentally messing with me. It was mentally having me going to sell my Gucci belts, mentally. So right now, I just believe this program is very great. I love the program, and I prefer the program to anyone. But I just want you guys to know, like, this facade, this smile is all because of God and McGreevy. Because, like, I don't look like what I've been through, but I've been through some things. And I just thank God each and every day, because most people that go through what I go through, they don't live. They don't make it through to tell their stories. They don't even get to help another person share their story. So for me sharing my story and I can help someone, I appreciate it. And I just want you guys to know my mom raised me so well. Excuse my hair with this hat. But they said when God about to bless you and you coming into some great things, you ain't got time to get ready. And I try to be presentable the best way I can. Amen. But I just want you guys to know I'm blessed to be here and I'm blessed to honor to be here. And I want to work on having more for us young ones, because we really don't know what opium is doing. And until 2010, I found out opium is in Percocets, and I didn't know that. I was just killing the pain of cramps. So I appreciate everything, and thank you, McGreevy.
Thank you, Jennifer. So we're gonna thank you, Jen. Thank you. And so I just want to, the whole idea of the panel was to look at, we're blessed to have the Attorney General here. We're blessed to have Judge Arleo here, Steffi, the First Lady, Haywood, and Caroline. And part of this is, God willing, after Jennifer's testimony, and Haywood's testimony, we're all a little bit changed, right? This is a beautiful young woman. This is a great guy, right? And so it's like we've got to understand that if we're gonna, could you guys keep it down over there? If we're gonna bless people with opportunities, we have to do it on a consistent basis so that they have the same opportunity, whether they look like Jim McGreevy, God forbid, or they look like Jennifer, or wherever they come. We need to have those opportunities. So I just want to sort of close and just ask every person to think about, this addiction crisis, the suburbs, and there's all sorts of challenges in the suburbs, and we're going to talk about that in terms of long-term treatment as opposed to people. My dear friend Ellen Egan is here. People going in and out of treatment, in and out of treatment, in and out of treatment. We were with the state police, and some people are going in and out of 8 programs, and the need to have best practices. But in terms of recovery, addiction, and reentry, I just asked you if you could change one thing what do you think it would be, starting with Madeline? Judge Orleo.
Would I change in my fantasy reentry world?
Yep.
Would be that we have real programs in prison that really address the needs of the people there so they transition more easily, and that we have better transitional programs.
Okay, and there's a great bill, Senator Cunningham's bill, Earn Your Way Out, and I just asked you to be mindful of that. Reverend?
Try to put some more technology into the minds of individuals that are in prison that are coming out. We've just opened up a 21st century technology building where we're bridging the digital divide. And I think if we do more of that, where we're teaching IT, Cisco certification, so whether you have a high school diploma or not, that you can come in and get this type of training and you can begin to make the money that's available to you also.
Thanks, Rev. And I just want to drive that home. It's employment, 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 and Reverend has a great program in terms of tech world. It's Cisco certification. It's industry-recognized credentials, so that that young man or woman, whether it's Jim or Jessica or whomever, has a credential that's marketable, whether it's at Prudential or whether it's at Whole Foods or whether it's at St. Peter's. And that's so critically important that we give young people, frankly, when public schools have failed, we give young people industry-recognized credentials so they have a marketable skill in the marketplace. Thanks, Rev. Hey?
If I had one thing, it would be to open up the lines of communication, and I mean remove the barrier so that when the person next to you is providing a service in a great way and the person across the street is providing another service, when we, in prison, we say, stay in your lane. Most of you are excellent at what you do, but you're not great at other stuff that you don't do. So let the people that are excellent at what they do what they do. You stay in your lane, and we'll change this state. We'll change this nation, and we'll be able to address all the issues. But it's talking once, you got one mouth, and listening twice because you got two ears.
Amen. First Lady.
Listen, I would just say I think that a lot of us can exercise common sense here. I think that if we all pull together and we look at getting out of our lane and we look at working together and perhaps coming up with your task force, I'm not sure, but it sounds like a good idea. But I think if we all just work together, I guess is the bottom line. Magic wand would be we no longer need to have prisoner reentry conferences.
Amen. General?
I actually have two things. One is that I don't think you should have to wait till Superior Court in a felony to get the advantages of drug court, that we should have municipal drug court programs.
Amen.
So we won't have to deal with the issue of reentry down the road. The second thing is that I wish more parents, we're talking about the opioid crisis, let's draw the stigma away from this and let's have conversations with our kids. We stood up a website, njcares.gov, to share the numbers with you, county by county, all across the state, about the opioid crisis so you could have conversations so we never even get to the reentry point.
Caroline? Could you speak closely?
I would say that folks who are in positions of great power exercise it with great conscientiousness and recognize the people that they need to listen to from the first moment they come in contact with them all the way through the process, that they can learn the most if they learn to listen to the people around them and let the people who they are trying to serve, the most needy, the addicted people that they come across, the people who are victims of addiction, lead themselves through the process, and that we learn to listen to them.
Thank you. Thank you, Caroline. And boy, I just sort of as a product of how many years of parochial school, I just saw Cardinal Tobin, so I want to genuflect. Cardinal, do you have time to break for lunch, or would you like to speak now? Okay. So, can we have a round of applause for the Cardinal? It's a sign of faith. This is, Pesach. Passover starts on Friday, starts tomorrow, and the Triduum of Good Friday and Holy Saturday, Easter Sunday. But there's nothing more miraculous than the Cardinal inviting Jim McGreevey for a blessing. But I just want to say thank you for the Cardinal for being here. I think if I can, and we're going to break for lunch, and remember, I say this every year to my dear friend Leslie McRae and Reverend McRae, this is fishes and loaves, so I'm tight with the dollar. I'm part Scottish. We have enough food for 400, so it's fishes and loaves. And then we're in the back, but there are three things that I want to take away from this morning. One is that wherever the opioid crisis came from, it's morphed into a fentanyl crisis. That fentanyl and carfentanil is 100 times more powerful than heroin. And as Steve Sterling said from the Star-Ledger, and Dr. Kolodny said, it shows no signs of abating. Secondly, we heard Dr. Berman and Dr. Bernstein, Gail, talk about best practices and linking together medication-assisted treatment, long-term treatment, as Prosecutor Coronado and John have talked about, but also accessing that based on best practices and a protocol. And that no matter whether you're starting in prison, or you're starting with IOP outside, or you're starting in drug court, or you don't qualify for drug court, and you're faced in criminal court, that if you're addicted, you're going to be treated. I just had a situation last week, young man, eluded police. He was drunk and addicted. So his fourth-degree crime got kicked up to a second-degree crime. And instead of being accessible to drug court, he's now facing 5 years. He's an addict. He needs addiction treatment. He doesn't need prison. And so part of this is having the prosecutor here, having the attorney general here, and all these prosecutors. I'm beseeching you, I'm begging to you, is to understand when addiction is the proximate cause of criminal behavior. While they may need time in the prison, and my dad was a Marine Corps drill instructor. I believe in tough love. But understanding the importance of treatment to getting them back to the promised land. And again, I just want to thank my dear friend Judge Arleo for what she does every single day of her life. And she's my dear, dear friend. I want to thank Steffi Bartley for not only being a dear friend and an advocate, and for getting off the golf course, for being here today. I want to thank Haywood Gandy, Hay for being my dear friend, and like Hay and I are like brothers of another mother, and for what he's done. I want to thank the First Lady for being here. And candidly, you might have read there's a little problem with the budget, but the First Lady could have ducked, but she's here, right? She's here. And that's what counts. What counts isn't always when it's easy. What counts is to give testimony. And I'd also like to say she was here last year. And that's what you need to understand. Can I have a witness? And I just want to thank also what the Commissioner of Health, the Commissioner of Human Services has done on hepatitis C and accessing that treatment. That's real time, real treatment. I want to thank our Attorney General. He's the best. He's the best. He's the best. And I want to thank also Caroline for what she does every day with the U.S. Attorney's Office. And we've got all the big shots here. But now, this sounds crazy because we've got a cardinal waiting. And there aren't many of them. And we're really blessed to have a cardinal address a reentry conference. And then I have our senior United States Senator. So what time is it now, Colonel? 12:38. So I'm just asking you, I went to Catholic school, so we all did it table 1, table 2, but I can't handle that. So we're going to get food, but by 1 o'clock, the Cardinal's going to be at this microphone. So Lenny Ward, you're in charge, Jersey City time, to get everybody moving. Grab a sandwich, not 2, but 1. 1 o'clock, the Cardinal. Thank you. Hey. What? Okay, Jabril.
I hope you realize you took my speaker.
Who's your speaker? Oh, no, but I'm just going to put it back. She's going to be on your panel, too.
Are you sure?
Yeah. Oh, she doesn't have to be.
I'm just...
It's up to you.
She looks like she's going.
No, she's still here. No, she's standing over there.
I mean, I can't find Reverend Dean.
He's going to be here. He said he's going to be late. Yeah.
Oh, okay.
Check, check.
You ready? All right. In 2 minutes, I'm going to announce it. You were great. How was that?
Great.
You crushed it. Like you
crushed it.
Hardly. This is the 18th. Hey.
I'm Micheline Farhat. Nice
Oh.
to meet you. I'm an assistant professor at Berkeley Community College.
Oh, wonderful.
Yeah, I'm really into the whole thing.
All right. I just got to introduce her. Hey, we're going to do 2 songs now. So can you crank it up?
It's unmuted?
All right.
It's like, it never found.
Unless I get a jury
You
question.
going? Okay.
I think so.
Okay.
Yeah, I think we're in.
And how do you pronounce your first name? Adjabro Muhammad. All right, so we're going to have one song for Adjabro Muhammad, and then we're going to have another song before the Cardinal goes on. So, ladies and gentlemen, don't take my water there. So, all right, Adjabro. What are you going to sing? All right, so I just ask you if you could just be quiet for 1 second. This is a great old hymn.
How are you? Good. I'll talk to you soon. All right, good. Oh, okay. How are you? What can I say? Oh, yeah. Oh, very nice to meet you. Hey, guys, how are you?
Nobody knows the trouble I've seen. Nobody knows but Jesus. Nobody knows the trouble I've seen. Glory, hallelujah. Sometimes I'm up, sometimes I'm down. Oh, yes, Lord. Sometimes I'm almost to the ground. Oh, yes, Lord. Oh, nobody knows the trouble I've seen. Nobody knows but Jesus. Nobody knows the trouble I've seen. Glory, hallelujah. If you get there before I do, oh yes, Lord, tell all my friends I'm coming to. Oh yes, Lord. Oh, nobody knows the trouble I've seen. Nobody knows but Jesus. Nobody knows the trouble I've seen. Glory, hallelujah.
All right, so we're going to have one more song prior to the Cardinals, so everybody get your lunch and enjoy. Can we have a round of applause for that incredibly talented voice? The grandson of the great Helena Muhammad, lifted up in praise.